Well, good afternoon, and thank you so much to Sura Kalori from the Bank of America and Dr. Olivia Mitchell from the Pension Research Center for this opportunity to serve on today's panel. This afternoon, I will share with you examples of how public-private partnerships extend community-based organizations' longevity, describe briefly Carter-Burton Network services, and touch upon the historical context of federal funding for aging services and what happens when public-private partnerships are reduced or eliminated. Public-private partnerships are essential to the survival of mission-driven nonprofits such as the Carter-Burton Network and others. In order for Carter-Burton to provide services to the community-dwelling older adults 60 plus, it requires innovative partnerships across the public and private sectors. The motivation for partnerships is based on the limited financial resources from the private and public sectors. Grantmakers in Aging, a nonprofit organization, reported that less than 2% of all American institutional philanthropic dollars go to support aging services, while a greater percentage of funding is provided by the city, state, and federal governments. Next slide, please. Why is Carter-Burton Network uniquely positioned to discuss the value of public-private partnerships? Carter-Burton Network, which we commonly refer to as CBN, was established a little over 49 years ago by a New York City Council member, Carter Burton, and his family foundation, which was formed as a public-private partnership from its inception, serving the needs of community-dwelling older adults living on the Upper East Side of Manhattan, including East Harlem and Roosevelt Island. It started in the council member's office with one employee, and it has grown to 12 programs, 7 locations, serving 5,000 low-income and vulnerable seniors annually. Carter-Burton Network is built on a 4-pillar framework of nutrition, social engagement, arts and culture, health and wellness, and technology is a common thread that is integrated throughout all of our senior centers and programs. This slide that you see before you shows you photos of our 4 senior centers that we operate and serve 113,000 meals annually. The photo with the red door is our Leonard Cavello Senior Center, which is designated as one of New York City Department for Aging Innovative Center, which requires it to be open 7 days a week. We have a membership of over 38 older adults that attend our centers. We also offer case management services to help with safety net supports, social services, as well as counseling, money management, and elder abuse assistance for the borough of Manhattan in the event that someone needs assistance with physical, mental, financial abuse. Next slide, please. This is the only one of its kind that's focused specifically for older professional artists 60 and up. In 2019, the gallery curated 35 exhibits featuring 120 artists, and the gallery celebrated its 10th anniversary, and it is solely supported by private partnerships. Next slide, please. The timeline shows the growth of the organization from its humble beginnings in 1971 from the council member's office to the expansion of senior centers, programming, and robust, diverse network of partnerships from academic institutions, hospitals, other community-based organizations, and government agencies. Next slide, please. It is important to understand the historical context surrounding funding, development, growth, expansion, and in some cases, stagnation of programs and services for older adults in the U.S., furthering the need for partnerships that can support seniors aging in place through enrichment programming and a way to address food insecurity. The Older Americans Act that was established in 1965 provides support for congregate meal services, which are provided at our senior centers, social and recreational programs, physical fitness programs, and family caregiving programs. Through the Older Americans Act, funds are provided to the state's 622 units on aging, and they in turn provide funding to the area agencies on aging. For example, the New York City Department for Aging. And the Department for Aging in turn provides funding to community-based organizations such as the Carter Burton to support a portion of programs and services. This slide also shows the Older Americans' annual discretionary funding that has declined over a 10-year period as shown in the graph from FY 2010 to 2019. The funding levels have remained below the FY 2010 levels, again contributing to the need for increased public and private partnerships. Next slide, please. This is our public-private partnership activity slide. I wanted to be able to show you the various programs that are supported through these types of collaborations. For instance, the model in the center is a senior who has designed her outfit. We, through our annual fashion show, receive support from Macy's for accessories, makeup, and also outfits. In addition, Macy's has also partnered with us to develop the Carter Burton Network Creative Arts Center, which is located at the Leonard Pavello Senior Center, where we have a ceramic studio and artist in residence program. You will also see that we have seniors holding up a certificate, and this partnership is developed through OATS, Older Adult Technology Services, which is a nonprofit organization designed to provide technology education to seniors on the use of computers, smartphones, tablets, and also help to set up Facebook accounts and email accounts as well. And then you also see on the right, disrupting food insecurity for seniors living in the community. As you can see, the lunchtime event at our senior center, where breakfast is 25 cents and lunch is $1.25 for a hot plated meal. This slide represents various partnership, public and private partnerships. Our knitting and crochet group is also supported by private partnerships through our Making Art Work program. Next slide, please. The Metro East 99th Street Hybrid Adult Day program was started in 2014 when CBN received its first New York State Department of Health grant to support the day program demonstration project through the Balancing Incentive Program under the New York State Medicaid Redesign Team to reduce the state's Medicaid expenditure. This project saved New York State Medicaid a little over $6 million. This is a very unique public-private partnership. As you can see, our partners on this project, affordable housing project, was the New York City Health and Hospitals Corporation, the Housing Preservation Department, the New York City Housing, New York State Homes and Community Renewal, and SKA Marin, a developer and project manager, as well as a private architectural firm. The Metro East 99th Street was the first development in the New York State area to use Medicaid redesign funds to create an affordable housing development. The Carter Burton Network was invited to be a part of this innovative, supportive housing project as the only on-site community-based organization to help assist seniors who had transitioned from extended nursing home care from the Goldwater facility, where many of them had resided in the long-term care anywhere from 2 to 22 years and were deemed eligible to live independently in the community. What is also interesting about this project is that Carter Burton Network made every effort possible to ensure that this program would remain viable in the Metro East housing development. Unfortunately, this is where times that public-private partnerships, when they're reduced, really have an impact on the clients that are being served. It is at the end of 2017, Metro East 99th Street Social Adult Day Program closed its doors. Seniors living in the building were encouraged to attend our senior center, roughly 10 blocks from the building. Although there were extensive public-private partnerships and extensive efforts by CBN to secure funding from the philanthropic and government sector, it could not extend the longevity of the demonstration project. Metro East 99th Street housing development remains a thriving part of the East Harlem community. Next slide, please. Partnerships to conduct community-based research. Carter Burton had formed a partnership in 2015 with the Rockefeller University Clinical Translational Science Center and Clinical Directors Network to conduct an academic community-based research study looking at how seniors were aging in place. From 2016, the CCTS funded Healthy was conducted by the partnership to assess the health status and health priorities of seniors receiving services through the Carter Burton Network. At two of our the study revealed out of the 217 seniors that participated in the study, 83% of the seniors had high, uncontrollable blood pressure, and which resulted in exploring the idea of how diet intervention may impact the outcome or make improvements on high blood pressure outcomes. And so therefore the partnership moved forward to apply for an Administration on Community Living innovative grant, innovative nutrition grant, and thus created the dietary approaches to stop hypertension, the DASH diet intervention at two of our congregate meal sites. There's very little, if any, research on the effects of the DASH diet in community-based congregate meal sites. This project is still currently underway, and we expect to have results by later. Next slide, please. Public-private partnerships are the lifeline, and I've provided you with various illustrations of the different types of programs that have been developed and partnerships formed. I provide additional information in the paper that gives greater detail about each of the examples that I've highlighted this afternoon. But what is critical here is that aging is everyone's business, and without public-private partnerships, risk for greater food insecurity, risk for increased social isolation, risk for reduced safety net services, case management, elder abuse, and social services, risk for increased healthcare needs, risk of disruption of public-private partnerships jeopardizes the longevity of community-based nonprofits. And so we want to make certain that we can continue to offer a viable service in the community through public-private partnerships for older adults. Next slide, please. Again, I want to thank Dr. Mitchell and Surah Kalori of the Bank of America. Thank you.